I'm the section chief for emergency medical services and preparedness and public health. If you don't know what we do a lot of a little, but we also run the State Health Operations Center. So if there is any type of declared emergency within the state of Delaware that has a health impact, our role at the State Health Operations Center is to do everything that we can through the plans, et cetera, that we have in our office to mitigate the effects, the health effects on the public. So where it all began, the One Health movement in Delaware. So let me tell you a little bit, a little story. So first of all, about me, I started a long time ago in EMS. I was a paramedic. I was very happy as a paramedic. I loved my job. If for those of you who don't know, the general motto for EMS is you call, we haul. So we don't care what somebody's problem is. We go out, we do the best care that we can, and we take them to the hospital. Now, when I was educated in EMS, again, long time ago, we had a couple of hours education in regards to infectious diseases. Basically, the education was wear gloves, and if it's not yours, don't touch it unless you have to. And back in the day when I started, we didn't wear masks in the back of an ambulance to stop any infectious disease transfer. We did occasionally wear goggles, but typically that was only if you were down, it was only if you were intubating, when you were really in somebody's space. But for the most part, our PPE was gloves. And, you know, we would take the pen out of our pocket with a gloved hand, and we would write our notes, and we would put the pen back in the pocket. And, you know, that pen is all kinds of contaminated, and nobody ever cleans their pen. So we were probably your original germ factories, just so you know, moving patients around. But it was fun. And I was blissfully unaware of all of the issues that surrounded infectious diseases. Now that I'm in public health, it's a little bit different. Some days I would like to go back there. But for those of you who dealt with COVID and had to deal with EMS providers in COVID, or other first responders such as police and fire who came walking into hospitals or came to pick up patients who didn't have gloves on or didn't have masks on or didn't have eye protection on. The reason is we do a very poor job of educating them in regards to infectious diseases transfer. But so that's where I started. And my thought process in public health has had to evolve to meet the demand. So when we started with our first One Health approach in Delaware was during Ebola. So Ebola 2014, 2015, we had a plan. We had a plan for taking care of patients. We had a plan for moving the high consequence infectious disease patient. We had a specific plan. The St. Francis EMS guys would come out. They were all dressed up. I would refer to them as Teletubbies because they were head to toe in PPE. And they would come out and they would put the patient in an isopod and they would move them so that there was no transfer. We had that down. We had to test it a couple of times because although it was not widely known, there were patients in the state of Delaware that were transferred from one facility to another, suspected Ebola. So we did have to do that. But one day someone came to me and said, well, what are we going to do about their pets? I was like, I don't know. What are we going to do about their pets? Can't a family member take care of them? Or can't this happen? Or can't that happen? They're like, well, if it's a dog, the dog could be infected. Oh, damn. I thought we had a plan, thought we had things taken care of because we had figured out how we were going to get food to them. We had figured if they were in quarantine, we had figured out other things. We hadn't figured out how to take care of the pets. So then we had to figure out how to take care of the pets. And we had our initial conversation with Department of Ag. And I did not know, again, I was not new to public health, but wasn't playing in this much of a realm in public health at that time. I did not realize that our Department of Ag deals typically with the state veterinarian at the time dealt predominantly with poultry industry and not with dogs and cats. So we had a conversation and we had a cell phone. They're like, well, who are you going to get to take care of the dog? And I'm like, well, why can't you take care of the dog? And the person who was the state vet at the time said, well, I'll get bit. And I'm like, well, that's not good. So we had to come up with a plan because we did not want to be, for those of you who remember, there's a picture up there, Bentley, the Cavalier King Charles Spaniel, that was the pet of the nurse who contracted Ebola. Anybody remember how much money that dog cost Dallas to take care of that dog? It was over $75,000 to have that dog in quarantine and to have people coming in and out to take care of the dog. Okay. So that's when we first started, because then it became more apparent that there were other issues that we were going to have to deal with other than just human disease. Where we went after that was to Zika. Everybody remember Zika? It was when the Olympics were in Brazil, I believe, and there was this big concern. Personally, my initial thought was, oh, good, we're going to kill the mosquitoes. That's awesome, because I hate the little bloodsuckers, right? But unfortunately, I then had to be educated in the fact that they actually have a purpose in life. They are pollinators. They are part of the food chain. So we can't just kill them off, because that changes the balance, right? So there was a lot of discussion with Zika. Denrec, is there anybody from Denrec here? Denrec, you guys have the tick person. You have a tick biologist? Okay, you are the tick biologist. Okay, so we have the tick biologist here. So they're the vector-borne diseases. So with Zika, we started talking about vector-borne diseases and its impact on the human. So we started working with DENREC and the tick biologist. We also started working with other aspects of public health in regards to Zika and how we could keep people healthy. After that, avian influenza, the first pass, which was about 2015, we were doing some planned training and development. We were working with Department of Ag. There was a really nice exercise that was put on. Were you at that? Were you there? That was before your time. Great exercise that was put on how Department of Ag and other folks would come out and do samples on the chickens and things like that so that they could test for avian influenza. I was there. Jamie Bethard, from those of you who remember back in the day, was there as the safety officer. Dr. Riley was there. And we're all kind of watching, and we're watching all this go on. And I watched someone who comes out of the chicken house who literally has the dirty swab stuck between these fingers, kind of like this, who takes out a cigarette, lights it, pulls the mask down, and starts smoking a cigarette, and the dirty swab's over here. And I was just like, but again, that's when Dr. Riley and I had a long discussion about how in the animal world, it's not necessarily so much about protecting the human from the disease when it comes to PPE. It's protecting from going from one farm to the next. So again, more discussion. We then had the issue with the HPAI in the egg laying facilities. And one of the things that we found out from that is, although we all think we talk the same language, yeah, we really don't. We really don't. We had some issues where there was conversation that we're going to quarantine movement. The next thing you know, I get a nasty phone call from Fire Chiefs Association going, "You're not going to tell me where to move my fire trucks." Well, nobody told you couldn't move your fire trucks. We said the state this was before Karen. The state vet said we couldn't move. It was quarantine. There would be no movement in this area. No bird movement. Calm down. We think we talk the same language, but we don't always talk the same language. So we need to make sure that we're a little bit clearer with what we're talking to people. And now we're dealing with the HPAI in dairy cattle. Fortunately, not in Delaware as of this time. And if it is, I don't want to know yet, because I go on vacation tomorrow and I really want to go on my vacation tomorrow. So just let me live in my little world if you could, just for one more day. But Now we're working with Department of Ag to make sure that we have PPE for the folks that work in a dairy farm. If you've never done it before, trying to determine how much PPE and the level of PPE that is going to be needed at a facility is extremely challenging. We did it with COVID, okay, for the hospitals and for the EMS system, and it was extremely hard. So you have to really take some time and think about it. We are fortunate that we do have some PPE stockpiled in the state of Delaware, that we can get through this crisis, and that we don't have lots of dairy farms in Delaware, that we can get through this should it come into the state. But again, it's a different thought process. It's something that I'm going to assume Ag has not had to deal with in the past, having to calculate out how much PPE would be needed. It's something we had never done in the past before COVID, because whenever the hospitals needed PPE, they just ordered it, right? And then we had a problem where we couldn't get it in. So now we have to do our calculations. We have to make sure that we have what is needed to get these dairy workers through. Other zoonotic diseases, I'm not sure if everyone here knows. I think they probably should, but in August of 2018, we actually had a person die of rabies in the state of Delaware. It's the first person to die of rabies in about 40 years, and it was in Kent County. The exact source is unknown, although it is believed that it was from a bite from a feral cat. Now, for those of you who also don't know, I am the public health duty officer pretty much 24/7, 365, unless I pass it off to somebody else. So I get all the phone calls at night and after hours for, I have a bat in my house. What do I do? First of all, don't touch it. Okay. Or there's raccoons in my house. There's a dead fox. There's a coyote that attacked a horse. That was recently. There's lots of cats around. Most recently, we had a call with from a wildlife nuisance wildlife trapper who called and said that they had a raccoon that looked neurological that had bitten somebody, and the woman refused to go to the hospital and refused medical care. So all these cute TikTok things and Instagram things where people are cuddling the raccoons and playing with the bats and the squirrels and stuff that they found, please don't touch it. Please don't touch it, because then you're going to be calling me at midnight because you're worrying about the fact that you were playing with this bat or squirrel or raccoon. And then I'm going to have to wake up somebody else here who in the audience, who are my infectious disease epis that are here today that get calls from me all the time. There we go. You would get calls back from them, not me, but I have to wake them up. So, and now some of the other things that we are seeing is diseases within the environment. Sorry, I'm getting a phone call, so I can't pull up my notes. Vibrio. Vibrio is a bacteria that's in coastal waters. Okay. And it blooms or becomes more prevalent during times of warm water. Anybody ever heard the old wives' tale of never eat raw shellfish in a month that doesn't have an R in it? Does anybody know why? Okay, the months that have R's in them, the water is colder. So it's a little bit safer, because during the warm weather months is when you have Vibrio that becomes more prevalent. But Vibrio can also you can also get it in an open wound, things like that. We have seen cases of Vibrio in Delaware. And then Enterococcus bacteria. Also, you do see, I grew up in the country. I know that if there's been a lot of rain, don't go play in the lake or the pond or the creek, because there's all kinds of runoff, and it's, needed everything to clear out for a couple of days. Lots of people don't know that nowadays. See it on social media all the time. Lake Como was shut down because it had bacteria. Yeah, give it 72 hours and let them retest it, and things will normalize. But there's a lot of stuff out there. So that there are diseases, there are different zoonotic diseases, there are vector-borne diseases, there are diseases within the environment. And as Kathy Jo said, since we are experiencing our first heat wave of the season, there's also diseases that can come from that or that can be exacerbated from that. One of the things that we need to do as providers, whether it is public health preparedness or emergency management or other healthcare providers, is we need to start looking at things a little bit differently. We believe that we look at things from the 5,000-foot view, and we need to pull back and look at things from the 50,000-foot view. The current approach right now for healthcare planning, for Office of Preparedness, for emergency management, I'm going to use a hurricane example. We know a hurricane's coming. We start planning 72 hours out if we need to evacuate or if we need to shelter in place. We get everything ready. We may move additional supplies in, or we may move patients out. And all that's great. And then landfall hits and everybody hunkers down. And then after landfall, we go out and we assess the situation, and we look for road closures or wires down or obstructions and things like that. And once all that's clear, we're kind of like, okay, see ya. We're done. And we're not. Because what kind of diseases or what kind of issues could come up from long-term power outages? Good example, Hurricane Sandy. In New Jersey, they had an entire helibase, and helibase is helicopter, not like hella. So a helicopter base was shut down because of norovirus. Someone from the community wanted to show their appreciation to the providers that were there, and they did home baking, and they brought stuff in. Well, they did home baking, but either their water was bad, or the eggs were bad, or the milk was bad, or the butter was bad, or something. But all the group of people who ate those goods ended up getting sick. This was 10 days, 14 days after hurricane landfall, because they had power outages. So you can have issues from power outages. You can have issues from contaminants in water. You can have issues from heat in general. And now that we are seeing changes in extreme weather, we're expected to have a very active hurricane season this year, the most active that we've seen in quite some time. I don't want to throw numbers out there to you because I wish I could be a weather person, because it'd be really nice to not be held to my predictions quite that much. But extreme weather issues that are coming with hurricanes, and it's not just hurricanes, but look at the torrential downpours that just hit in southern Florida, where they had feet of rain in a very short time frame. Look at some of the straight line winds that we have had that have come through, that have taken out buildings, that have taken roofs off of buildings, things like that. Look at, we typically don't see it. There's wood around here somewhere. Some places are having extreme amounts of snowfall or extreme drought. Okay. So all of this affects the health of the environment, the health of the people, and the health of the animals. And we have to pull it all together. And we can't just go, okay, there's a hurricane, the hurricane made landfall, the hospitals made it through, most of the developments are through, but we're going to have power outages for days. We can't just do that and then walk away. As public health preparedness, as the public health lab, as community health partners, we have to make sure that we are prepared, that we have good messaging for our people, that we can do that primary prevention with good education to get out to the folks so that we can prevent any type of illness or disease in a One Health approach. So that's how we're evolving in Delaware. I challenge everyone to take that thought process and that jump from, hey, I got gloves on, everything's cool, to where we are today with the full gear for infectious diseases. And also looking at how the climate is impacting our health on a day-to-day basis. I had Molly show me today when I came in, there was a spike, not unanticipated, of people who sought care in emergency departments in our state for heat-related illness over the weekend. And what type of impact is that going to have on that person, but also on the healthcare system as a whole? So that's all I have for today. Thank you.